Hi, my name is Carissa, and I'm going to demonstrate how to prepare and mix insulin. So first I'm going to do my hand hygiene. Before I start preparing the insulin, I want to check my doctor's orders against the MAR, noting if my patient has any allergies or if they've had an insulin injection before. So I have my doctor's orders here and my MAR. Looks good. So I should know the patient's blood glucose as well as what insulin the patient is receiving. If they are receiving more than one type, we need to determine whether it can be mixed because long-acting insulin can never be mixed. According to the orders, the patient will receive Novolin GE and pH, AM and at dinner, and Humulin Lispro QID as per sliding scale. And the morning glucometer reading was 10.6. So knowing what their glucometer reading is necessary to figure out what Lispro dose since the patient is on a sliding scale, as well as to ensure that they are not in a hyper or hypoglycemic state. The orders for Novolin GE and pH is 22 units at breakfast, and for the Humalog Lispro, we will give 4 units since they are on a moderate regimen for sliding scale, and the blood glucose is 10.6. So the supplies needed include an insulin syringe, both vials of insulin, and some alcohol swabs. Now I start with checking the labels of the insulin against the MAR and the expiration date of the vials. It's also important to know the onset, peak, and duration. I need to ensure that my patient will be receiving breakfast within 5 to 15 minutes in order to decrease the chances of hypoglycemic state since they will be receiving a rapid-acting insulin. So I'll just check the orders and the expiration dates. Perfect. Good. All right. So during preparation for insulin injection, it's important to maintain an aseptic technique and ensure the 6 rights of medication administration as followed. So right medication, right patient, right dose, right time, right documentation, and right route. We need to calculate the total volume of insulin needed. So I'll be giving 22 units of NPH and 4 units of Lispro, so a total of 26 units. Double check this dosage by asking another registered nurse. We need to visually inspect the insulin vials before administering and do not use it if it's clumping, frosting, precipitating, or has altered clarity or color. These vials look good. So we want to roll the NPH vial in our hands. There we go. And that's just to suspend the insulin preparation, and then we can wipe our insulins with an alcohol swab. So I'll start with the rapid acting. Wipe this one. And then with a new alcohol swab, I will do the NPH. And then you want to pick up the syringe with the pre-attached needle. So that's the one I have here. So we will open this up. And then we want to aspirate the equal amount of air being administered to the syringe in the NPH. So we want to draw up 22 units of air. Just going to move that out of the way. So 22. Go. So we have 22 units of air in here. We're going to take the cap off, and then we're going to insert it into the NPH vial, being careful to not touch the solution with the needle as it will contaminate it. So we want to insert the air, and then we will take it out. And then we want to put the amount of air that we will be putting into the rapid acting, so 4 mils of rapid acting. there's 4 mils. We will insert it into the rapid acting vial, insert the air, invert the vial, and then we will take out the 4 mils that we need, which is right there. Make sure that there are no bubbles, which are good. And then we will confirm the dosage of the rapid or short-acting insulin. So making sure we have 4, and 4 was ordered according to the regimen. Good. So then we want to determine at what point will be when we add the second insulin. So we will be at 26, so I will be right here. Okay, perfect. And then we can insert the syringe into the NPH, invert the vial, and carefully draw the desired amount of NPH into the syringe. Do not overdraw or push any insulin inside of the NPH vial, as it will contaminate the vial. So we want to withdraw the needle, or we want to withdraw the solution, so up to 26. There we go. Withdraw the needle and double check the number of units in the syringe. Perfect. And then we want to cap the needle until we're ready to administer the medication. So I have the cap right here. Just going to cap that. Perfect. Then we can dispose of the supplies, clean the work area, and use hand hygiene. So I've disposed of everything that I used. So now it's time for administration. So we want to introduce ourselves to the patient and check the patient using 2 identifiers, so full name and birth date. Once you have determined the site to be used, we can inject the insulin. So I have my patient right here, and we have our insulin right here. So we want to inject it at a 90-degree angle. So in we go. And we're injecting. Perfect. And once we finish injecting, we always need to remember to recap the needle, or cap the needle, and dispose of it in a sharps container. So I have a sharps container right here for it to go into. For the follow-up, we need to be alert for hypoglycemic reactions, and we need to teach our patient to ring their call bell or alert the nurse if they're having any symptoms of hypoglycemia, such as fatigue, sweating, pale appearance, irritability, lack of coordination, or increased hunger. And then we can teach the patient about injection sites as well. So we need to teach them to rotate their injection sites, and when all sites rotate the injection sites in the same region. And when all sites in the same region have been used, they can move to another region, or they can start the rotation over again. If they pick the abdomen, we need to teach the patient to avoid a 2-inch radius around the umbilicus. For documentation, for sliding scale insulin, record the blood glucose reading obtained before the insulin administration. Record the insulin administration in the MAR, including site of injection, and document patient teaching regarding insulin preparation and administration, and the patient's response to the teaching.